All right, good afternoon, everyone. I'm Mark Goldstein from UCSF Health Hub, and welcome you to our semifinal round of our UCSF Digital Health Awards. We're going to start off with a video, and we're going to get right into it.
Welcome to the second annual UCSF Digital Health Awards 2020, the Academy Awards of Digital Health, where we honor the best technologies that are defining and leading the digital health revolution.
We want to improve healthcare.
So we're really excited to be part of this wonderful evening.
Collaborators include the top healthcare incubators, accelerators, and venture capitalists across America, featuring the top 100 digital health innovators in the country selected from over 1,000 entries, 15 curated award categories, hundreds of judges selected from the healthcare community, healthcare industry thought leaders, thousands of online attendees, and dozens of virtual events, culminating in the September 23rd finals, honoring those who are reshaping the industry and making a difference in the COVID pandemic.
Join me, Twee Vu, as we honor the role digital healthcare plays in rewriting the future of health.
And the UCSF Digital Health Awards is narrating that future. Join us on September 23rd at 6 p.m. Pacific time for a 90-minute celebration as we honor these winners, changing the future of healthcare.
Excellent. Well, good afternoon, everyone. Again, I'm Mark Goldstein, and this is our second roundtable discussion, and today it's we have our winners for the employer wellness category. It was actually we had almost 100 nominees. We're down to the last 4 companies, and we're excited to basically put this together. Let's talk about the agenda today. We're going to start with some introductions. We've got a great moderator in Kyle and from DCM, and I'll be able to introduce him shortly. We're going to then get into a roundtable discussion, and this is really the opportunity for the companies to differentiate themselves. While we have hundreds of people live right now, a big part of this recording and what we're doing today is getting it to all of our judges. We have 250 judges who will then use this recording and the submissions the companies made to make their final decision on who is the winner. Then we're going to go to some questions from the audience, and we're going to kick it off with some of our own roundtable discussions, and so just to make sure we keep these companies on their feet and have a little fun. This is only a 45-minute session. We're going to end sharply at 45 minutes, but it really should give you a great sense of who these companies are and why they're doing what they're doing. A little bit about me. I founded UCSF Health Hub, which is a nonprofit associated with University of California, San Francisco. We are a accelerator incubator, and what we do is we help companies scale and grow. One of the things we're doing here is putting together and we're producing this the second annual UCSF Digital Health Awards, and excited to be here. My job on the side is I'm a VC, as is Kyle, and I'm a partner at a firm called Builders. I invest in digital health, and so this is sort of what I live and I breathe, and I love this stuff. You know, at Health Hub, this is a nonprofit. I'm a volunteer. Kyle is also on our board of directors, and he volunteers a lot of what his help on Health Hub too. So I actually know Kyle really well. We sit on a board together. He's a partner at DCM, and I'll let Kyle talk a little bit more about DCM. One of his focus is on health and health technologies. He's had a few great wins. He's a former operator and co-founder and former CEO of ChoicePass, which was acquired by Ripple and Salesforce. He then worked at Salesforce and at Work.com, and he really knows this space, and I think he's going to be a great moderator. Kyle, I'm going to turn it over to you and talk a little about, tell us a little more about you and employer wellness.
Thanks, Mark. So Kyle Liu, I'm a partner at DCM. DCM is a global venture capital firm, been around for almost 25 years, one of the more established firms in the Valley. We have actually been actively investing in healthcare for the last 10 years globally in our core markets of North America, China, and Japan. Me personally, I'm spending about a third of my time in digital health now. As Mark mentioned, recently joined the UCSF Health Hub board of directors, and really excited to be a judge for the first time this year. And I've seen a tremendous number of exciting companies in the employer wellness space. ChoiceFast actually started off, you can kind of think of it as a mix between kind of HR software and sort of like work management. And spent a lot of time selling into HR as part of ChoicePass, and then Work.com, which is a performance management suite, kind of part of the prior generation, was fully selling to HR. So know this space really well from the enterprise software side, and really excited about the companies that are going to be presenting today, and excited to be moderating. Here's a sponsor slide. I guess I'm not going to go through this slide.
Yeah, well, this is, I realize that we could have done this up front, but we are at Health Hub and the entire awards event. We are, DCM is one of our sponsors, and we thank them. We are, again, a nonprofit, and that's our money comes from our sponsors. Big sponsors for the awards event are Wilson Sonsini, NTT, Silicon Valley Bank, Livongo, and then you can basically see all of these other great VCs on the list. Thank you, Kyle, and thanks for, DCM is a truly great firm. I'm going to get into how we got here and then turn it over to Kyle. So how did we get here? Today we have four companies left in a category. This is one of 15 categories. We've spent the last 3 months doing judging. And the way it started is companies submitted. They submitted to win. And we had literally over 1,000 submissions. We culled it down to about 750 that met our criteria. And so we are now down to the last 40 or so, or 35 or so companies. We have 3 rounds of judging. We did a first round, we did a quarterfinal round, and we've now basically completed a semifinal round. So we're left with just 4 companies. Our judges include folks that are analysts, that are VCs, that are run hospital systems, that are physicians, clinicians, and basically, but everyone who's raised their hand saying, you know what, I know a lot about digital health, and I have a good perspective. And so our judges come from all across the country. So our second round of judging criteria, we actually created, there are 50 points in this round. The first round was really us getting through a lot of companies. So there was a lot more focus on validation and market traction to make sure that the companies that got to the semifinals round really were making a difference out there. The criteria here was, we got 10 points out of 50 to value of customers. Are these companies making a difference, and how important is that difference? Up to get 10 points for a level of innovation. How innovative is this company? Is it really breaking rules? Are they standing out? Are they doing things that other people aren't doing? Validation, of course, is important. We want to make sure that the cures that are basically being worked on here are cures that are going to hit millions upon millions of people. Market traction is important too. We wanted to see, were you in market? Was the company successful getting their products out there? And the reason that's important is, at the end of the awards event, we do a lot of work working with all the hospital systems around the country, making them aware of all of our winners, semifinalists on up. And then it's level of differentiation. How are these companies different? Like if they're not, in this case, it's like, how are these last 4 companies different from each other? But before it was like, how are they different from the other hundreds? Differentiation matters because you got to be number 1 in your niche. So here we are. This is the Best Employer Wellness company category. And this is our badge. This is one of the many assets the company gets, and they get trophies and all the variety of swag and good things. But to that end, I'm going to turn it back to you, Kyle, and you can introduce the companies.
Yeah, very excited to introduce 3 of our 4 semifinalists today. We have David, co-founder and CEO of Amino. We have Julia, the CEO of Lark Health, and Ben, Senior Director, Product Marketing at Grand Rounds.
So,
So,
yeah, go for it, Kyle.
so here, so the semifinalists haven't seen these questions ahead of time, but this is essentially what we're going to be asking them. So what's so unique about your solution or solutions? What does the existing user journey look like? What is your validation? How did you differentiate yourself? And where will you be in the next 5 years? Or where will the next 5 years take you? So with that, we're gonna go ahead and get started.
All right, Julia, it's all you.
It's great to be here. Thank you, Mark and Kyle. Our mission is to help anyone struggling with a chronic condition or at high risk of a chronic condition or behavioral health issue to really get that personal, compassionate care, but do it at an infinitely scalable version so that anyone in the world at any time can get this care. And so what really differentiates us from other chronic disease management and prevention platforms is our use of AI. And to really create a 24/7 AI care team that texts with you within 1 second of you, whether it's 1 a.m. at night or when you're on a walk, in the forest. And so what we do is we treat millions of patients with a connected device and a personal 24/7 coach. And we provide care in diabetes, prediabetes, hypertension, smoking cessation, behavioral health, in the most critical areas of chronic care. And today we have treated close to 2 million Americans with a highly affordable and scalable solution with clinical equivalence to live nurses and a much more breadth in ability to scale with our health plan clients as well as our employer clients. So today we work with hundreds of employer clients. We work with 3 of the top 7 health plans nationally, which represent a majority of the US members or US population. So that's us. May I ask, do you want me to go through each question one at a time?
I think that was awesome. We'll just go right to the, we got questions for you later. That's
okay, great.
Yeah, that was great. Next we have Ben from Grand Rounds.
Cool. Thanks, everyone. It's great to be here, and all of the companies here are super impressive. So we're really humbled to be in good shared company. As we think about kind of what makes us unique, I think really thinking about what's going on in the market is also important. So we believe the health disruption that's kind of affecting everyone in the country right now has really accelerated the adoption of a virtual first healthcare model in the US. And so our products, which include, expert medical opinions and healthcare navigation and now virtual primary care, can really meet the needs of anyone who's going through any kind of virtual first patient need. So it could be an acute or chronic health need. It could be straightforward or complex. It could be clinical or purely administrative. We're condition agnostic, so we welcome all types of member needs, across all different kind of walks of the healthcare field through our patient experience to serve really any of those things. Our product suite, including those 3 products, covers many of the different needs that an employer could want to solve. And so if it's narrow and focused on, the 5% of your population that's driving 50% of the cost, expert medical opinions is a really good option, all the way up through, healthcare navigation and virtual primary care, which has really an addressable market of the whole population of a given employer. as we think about what makes us different and unique, we think it really comes down to a couple of things. One is an investment in clinical expertise that's threaded throughout our products, and investments in physician quality measurement. And so understanding through a ton of data science and AI, which doctors are the right ones to treat patients. And so we've got 100 plus licensed clinicians full-time on our staff, licensed to practice across all 50 states, who collaborate with our product teams on product design. They interact and interact with members and lead all of our member-facing care teams. They participate in the algorithm design process with our data scientists, and really ensure that there's the top standard of care throughout all of our products and every patient interaction. And then in terms of quality measurement and understanding who the top doctors are, we've invested over $75 million to date to really understand and study this problem. We've got over 30 full-time data experts working on this problem year round. And through those investments, we've developed what we call the match engine, which measures physicians across 4 criteria: efficiency, safety, cost, and gosh, I'm blanking on the last one. Sorry, effectiveness. And through that measurement, we surface up the highest quality doctors on that set of criteria. And then the matching part is also then quantitatively identifying the specific member need in question, so we can match the highest quality doctor to the specific need of that member. And that is how we can ensure that the right doctors are treating the right members for the right conditions. And then these capabilities kind of combined with a sleek digital app, centralizing everything that the patient could need kind of at their fingertips, a care advocacy team that's really going to run through walls and support members kind of throughout their journey. We've created this kind of all-encompassing single entry point to healthcare, where members can bring any health problem, know that their problem is going to be resolved quickly, compassionately, that they'll be treated like family. That's really kind of what sets us apart in this market.
Great. Excellent.
Got it. Great. Thank you, Ben. Last but not least, we have David from Amino.
Yeah, thanks for having me. Our value proposition is incredibly simple. We make getting the best possible healthcare as easily as using something like OpenTable. Americans struggle with not only numeracy and literacy as it relates to what is high value care. Where can I get a surgery that's not going to land me with an infection? Or where can I get an image done that's not going to break my bank account? They're also struggling with access. So a lot of our customers may not know who's taking on new patients, may find that they live in a small town, and if they needed treatment for their Parkinson's disease, can't get that high quality treatment without getting on a highway. So Amino partners with employers, and we make it easy for every single one of their employees and their family members to be able to search and book for care, knowing that they're getting the highest value providers without ever needing to become an expert in their care. We use a little over 3 billion health claims per year. Amino combines both Medicare and commercial data to assess cost, quality, appropriateness, experience, and network status of over 1 million doctors in the US, 7,000 ambulatory surgical centers, almost 10,000 urgent care centers, 15,000 imaging centers and hospital-based imaging centers. So over 80% of a medical spend for an employer is covered by the search keywords, numbering over 1,000 that you can do inside of Amino's app. When someone searches on Amino, they're getting the highest value providers with our label called Smart Match. And Smart Match basically runs through a series of criteria that we've calculated to allow our members to be able to know that they're getting high value care. They book online, much like you would a dinner reservation, or in today's world, maybe a DoorDash delivery. And those members give us a net promoter score over 80, meaning that they absolutely love and would highly recommend the experience that they're getting. Because they love using the experience, we get nearly 1 out of every 2 members using our product. It eclipses the engagement rates of almost every product in our category. As a result of people using it, we're able to drive 5 times the value that someone invests in using a product like ours to the health plan. We do that because by choosing the types of providers that we recommend inside of our product, those employees are spending less of their employer's money and their own on their care, such that we can take an employer, for example, one of our customers spends about $5 billion a year on healthcare. Almost a fifth of that is being spent on out-of-network care and care that's also inappropriately provided. We've been able to reduce the amount of spend on healthcare by our customers by nearly 5% of their total budget. And as a result of doing that, we're able to make a much more convenient, intelligent access point to the US healthcare system, so members feel like they're getting absolutely a higher quality benefit, being able to more conveniently book care with every provider in the country, and their plan sponsor is able to know that those folks are able to make decisions that they would otherwise not have made, thereby reducing the total financial footprint and health footprint of every one of those member decisions. In the last 18 months to 2 years, we've grown over 20x in the number of members, such that we now have over 1 million people who have access to Amino on a daily basis today. Likewise, we've also grown our revenue quite substantially along with that, because we're able to really tie what we do in terms of the results. Last thing I'll say is that we believe fundamentally that consumers don't just engage in their own healthcare. They need the support of advocates and on-site clinicians and telemedicine vendors. And so we've partnered with third parties. Any telemedicine, on-site, or advocacy service that an employer has chosen can make use of Amino to benefit those members and thereby increase the engagement rates even further. And so our vision is, over the course of the next 5 years, being the way that healthcare demand is allocated in this country, making sure that every single person lands in the waiting room of a physician or a hospital that's going to take best care of them at the best price.
Excellent. Hey, well, we have our fourth, Kyle, we've got our fourth collective health. The last minute they couldn't join us, but we'd like to sort of just read really quickly what their highlights are.
Right, and I can do that for you. Collective Health was our 4th semifinalist in this round. Collective Health partners with employers to revolutionize their healthcare investments and streamline the system for a better experience. What's their validation? They're driving CSAT and NPS levels up to 8 times insurance industry averages. And why do they think they should win is because they honestly believe they're on this mission to deliver optimized care at a great and provide a great patient experience overall while reducing employer costs.
Perfect. Okay. So what we're going to do now, this is Kyle and I get to sort of team up. We've got some questions that we have not shown to any of the companies yet. And this is really, so we want to tease a few things out. The first question I'll start with it is, and we're going to go around and we're going to ask each company, you have 30 seconds to really nail this answer. And how are you changing the status quo in your sector? That's your department, that's your specialty. Tell us how you're changing the status quo in 30 seconds and why this was really the story, why you really matter. Why don't we start? We'll go in the same order we did before.
All right, I guess I'm up. Our sector is really chronic disease, those at high risk of chronic disease and behavioral health. And unfortunately, this is the big epidemic of our generation, COVID notwithstanding, but it is 86% of all healthcare costs going to chronic disease and pre-chronic issues. And for us, we made the big realization that there are not enough doctors and nurses in the world to care for chronic patients in the way that they need to be cared for, which is ongoing, longitudinally, with high touch. And so we decided we have to do something about this. And we decided to use conversational AI to scale that human interaction between people and their nurses so that they could get the care that they needed on an ongoing basis. Really influenced by all of this data that is coming out through devices. We pull in genetics data, 70 or so medical devices, and personal preferences to create ongoing treatment. And if you looked at our nurses today, our AI nurses, they represent, based on the 355 million text messages back and forth with our millions of patients, they represent the workforce of 14,833 full-time nurses. And we hope to make that millions of nurses so that we can help extend care and make it more compassionate, and personal.
All right, Ben, how are you changing the status quo? 30 seconds.
Yeah, so I think as we think at Grand Rounds about changing the status quo, what we're really trying to do is really push the boundaries of what is possible for a member to accomplish all in one place. And so through kind of the introduction of healthcare navigation and virtual primary care, you can now bring any need through that front door, get treatment, get a virtual physical, get behavioral health sessions, but also just kind of understand your benefits, your deductible tracking, your bill, what something's going to cost. And so like as a member, anything that you need to accomplish, you can basically not worry about where to bring it other than to know to just bring it to Grand Rounds first, and Grand Rounds can solve it. And then in order to do that, we're bringing the clinical expertise and really the data analysis and artificial intelligence expertise in order to enable all of those things. So powering all of the ability to kind of answer all of those patient needs are 10 billion plus data points underlying all of the services. So we're taking in all different forms of claims data. We're taking in the admission, discharge, transfer data from hospitals. We're taking in biometric data. And when you can stitch all of that together, you can model out which doctors are the right ones, which patients are the right ones to actually target for engagement. And so you can attract all these people in, connect them with the right clinical experts, accomplish everything that a member needs to do in one place. That's kind of how we're seeking to change the status.
Okay, and David, you've 30 seconds. How, tell us everything at Amino. How you're changing the status quo.
We're doing two things that are structurally different than the status quo. Before Amino, there are lots of transparency and navigation solutions. You can get what's free from your insurance company. You can pay a lot of money to try and build something over many months, or you can pay for a big, expensive navigation service. We democratize all that. Our customers are able to stand us up in weeks. We support customers that are only a couple hundred employees all the way up to an entire US state. And healthcare is just not evenly distributed, and and high quality services should not be delivered solely to 100,000 person companies. So number one, we democratize that. And number two, we think of ourselves as not just a hub or a single destination. Navigation is threaded to every single clinical service that's offered to a member. I get referred all the time from my disease management system or from my on-site clinic or from my telemedicine service, and they're all equally blind. What Amino does is it puts our intelligence inside of all those folks that work together to drive people to high quality outcomes. And I think that has made us more effective in driving the types of results for our clients.
Great. Kyle, turn over to you.
Yeah, so the next question is, tell us why you're solving a big $1 trillion problem. This is a classic VC question, basically, how big is your market? So let's start actually with David and go back around.
Sure. It's all intuitive that not all doctors, hospitals, imaging centers, surgical centers are the same. Some are way better than others in terms of not only cost and quality. We've just never been able to capture that difference and put that back in the pockets of American companies, labor unions, state agencies, and of course, American families. So we think it's a $1 trillion problem because if you look at just the $800 billion to $1 trillion that's just in waste between unnecessary care, overly expensive care, unsafe care, and surprising out-of-network care, Amino represents protection against hitting any of those landmines. We do that across the vast majority of healthcare needs. It's not just surgical procedures or cancer care. It's everything from cancer on down to milk allergies. And as a result, we're able to drive a maximum amount of impact for our clients and for their families.
Got it. Great. Ben, you're up next. 30 seconds.
Yeah, so if we just, again, as David said, if you look at how much is wasted in the country, it's anywhere from 750 to $1 billion purely in waste. And if we look at what's driving the waste, we think it's just the pure fact that healthcare is really difficult to navigate, and patients don't know where to go for what, and that results in a couple of things. Decision paralysis, or they don't do anything. Making an uninformed choice where they don't have enough information on who's great at what they do or whether they should be enrolled in this program. And they go down a pathway where they get pinballed around the system and then they have to come back. All of that has a price tag associated with it. And so, we started with expert medical opinions to focus on the most complicated stuff. We expanded that into physician quality so we can route people into the right doctors. And our learning is, while those are parts of the solution, really the need to address all of the navigational elements. So not just who's a high quality doctor or what's a high quality hospital, but who are the right members to actually target? What are the right programs for them to be involved in? What's going to be the thing that gets them to adhere to their medication with the highest rate of success? All of those things affect everybody in the country in a very human way. We want to level the playing field for everybody. That's why we're focused on this $1 trillion problem.
Got it. Great. Thank you. Julia.
Thanks, Kyle. So chronic conditions are costing the world $3.5 trillion a year. And it really will break the healthcare system if we don't take care of that. So, one of the big issues is that people don't get the ongoing care that they need and end up in the ER after delaying, care that they need, but they don't know where to get help, and they don't have the tools to pull themselves out of managing diabetes correctly, managing their hypertension issues, to reduce stroke. And so this is the place that we are really focused on solving, to provide real-time care to anyone without any cost. So our services are 100% reimbursed through claims reimbursement, or payers paying for the service. And it really is that additional support system that's needed to bend the cost curve for chronic care and chronic behavioral health care.
Great. Thank you, Julia. So Julia, we're going to stick with you. This is a good transition to this last question of how is COVID shining light on what is it that Lark is doing?
Yeah, it's so sad. COVID, of course, is one of the tragedies of this generation, but I also think that it is the #1 thing that will transform healthcare for the better. I heard a crazy statistic that 80% of COVID deaths were those folks at high risk who had a chronic condition. So the populations that we work with are at higher risk, and we need to keep those folks home and safe and still getting care. So I think COVID is really transforming the industry to adopt a new type of virtual care that's care across the entire continuum, holistic care, not just using telemedicine for an urgent care issue, but really taking that whole care continuum onto the virtual platform. And so for Lark, it's really treating the behavioral health, chronic care, prevention issues. And then when things are really bad and we see needs for triaging and escalation, we can escalate to our telehealth partners, to the population health nurse call centers that health plans have, to clinical resources, so that they can get their care while doctors perform at the top of their license. So we think that COVID is really going to bring healthcare into the virtual world.
COVID shining light on grand rounds.
Yeah, yeah, I thought Julia raised a lot of really good points. Like for us, two things really come to mind. One, if we thought healthcare was hard to navigate before the onset of COVID, oh my God, did it get more complicated right at the outset. I mean, back in March, April, and May, when we were taking phone calls from our members and our customers, they didn't know if they could go outside or not. And so just the sheer confusion over whether a test was covered or what it would cost or how you even get one and why the results haven't come back in 2 weeks, that was really crazy. So just it became harder to navigate healthcare with COVID. I think the other thing, I thought Julia put this well, more can be done virtually than ever before. And I think this is what tipped everyone over the edge to really being forced into a position of trying things out virtually for the first time and starting to appreciate that actually you can do things virtual first. And so if we just look at some of our own data, like the relative increase post-COVID to pre-COVID of things like diabetes and hypertension and back pain, you know, hypertension treatment virtually is up 600+%. Diabetes care virtually up 400+%, and back pain up 300+%. And so just the notion that you can do these things virtually, I think is going to stick and is going to hold. And that's how COVID has really, I think, expanded people's thinking about what's possible in kind of a virtual healthcare world.
Great, thanks, Ben. And David, same question. How is COVID shining light on what Amino is doing?
Well, you know, our job that our product has been hired to do is to optimize the utilization of the US healthcare system. And in any normal world, we have a proven, validated approach to get people to high value providers. COVID's changed a bunch of things on both supply and demand. So on the supply side, you see clinics have closed, elective surgeries have been canceled. You know, one study predicts that there's going to be 1 million cases of spinal fusions and other backs or joint replacement surgeries that are backlogged as a result of this pandemic. On the demand side, obviously, people are unwilling to go out as much as possible. So they are consuming more virtual care. So what we've done is we've introduced a few things. One is that we think we're an incredibly important resource for rationalizing all of that re-engagement that's happening as we start to turn on the system again. The unfortunate thing is that as we rush to get this backlog of surgeries done, we may choose providers that are unsafe or all too willing to take us on as a patient when we'd be better off going across town to someone cheaper and more appropriate of a provider. So we're helping organize the re-entry of patients back into the US healthcare system. In the meantime, we've also turned on booking of COVID testing inside of Amino. So a number of our customers have turned on into their experience on Amino the ability for you to book COVID testing directly from your Amino online experience, which is a huge convenience for them. It's going to increase and accelerate their back to work strategies. And then the third thing that I think is important, you know, my brother's an ear, nose, and throat doctor down in Florida. They've just reduced their patient counts. They're taking different, you know, on-call strategies. Just the ability to access normal specialty care right now for ongoing needs has changed. And so, for example, additional screening questions have been added to most patient intakes at most clinics. And so we are helping to hold the hand of a member and understand whether they're able to get access to a provider, if that provider is still in business or if they're open or changed their schedules as a result of COVID. So what's happened is the supply has become time shifted, and we are going to see, I think, a whole bunch of different procedures done. We're helping to organize that reentry. And then secondly, those changes in demand that are happening right now in regular care have caused both people to need new types of care like COVID testing, and also when they're engaging with even a primary care doctor or a specialist needing to get over a new set of humps. And Amino's focus on convenience and guiding people to the right care has just come to the forefront.
Great. Well, Kyle, and let's, I think it's really important we finish this up in 45 minutes, and that gives us about 2 or 3 more minutes to go. And first of all, to the companies, huge congratulations to you all. This is not, I mean, this was 2 or 3 times as hard as it was last year. We had, you know, again, 750 companies coming through. We're now down to the last four in what is a, you know, a multi-billion-dollar category. This is huge congratulations. So on, you know, on behalf of everyone at UCSF, we wanted to congratulate you. One of the things that we want to then focus on is, look, what's next? So everyone who's on there today, our grand finale is in a little over a week. It's at 6 p.m. We purposely have done it late. It's a 90-minute show. It's a fast-paced show. We're doing it from a production studio. We have, you're going to basically seeing all of the people from around the country that are taking a part in this. It's going to be a great way to sit at home with a beer and to celebrate basically what's been a pretty terrible year, but the fact that we're doing, goddamn it, we're doing everything about it to make it less bad. Kyle, what would you add in terms of a good closing from a thinking about this category and from the perch you sit at DCM?
I mean, this is, if you look at the different areas of healthcare, the intersection with healthcare and, you know, the employer side, it's such a massive market. It's such a massive opportunity. And so I'm really excited for all of these companies and looking forward to the finals. That's
great. Well, with no ado, I'm going to let everyone go. This is all going to be recorded. It's all going to go to all the judges. This has been super helpful. You guys were great. Tell your friends, tweet it out. Let's get, we're targeting 10,000 people to join us in a week or so. And we're looking forward to it. And thank you again, guys, and have a great afternoon.
Thank you.
Thanks so much.
Yep.
Thank you. Bye-bye.